Welcome. Chronic neck pain, disc problems, arthritis, facet joints, degenerative disc disease, alteration of the normal curve going in the opposite direction. The architecture of our spine is very important. Looking from the side, you should have a normal C-shape inwards lordotic curve. Problem is with forward head posture, sitting, driving, looking down at a computer, even texting all day. The head goes into the opposite direction, looking down. Remember, the head weighs 12 pounds. For every inch the head goes forward, it's an additional 10 pounds. 1 inch, 22 pounds. 2 inches forward, 32 pounds. And 3 inches forward, 42 pounds. And even anything above 3 inches puts a tremendous toll upon the ligaments, muscles, joints, and ultimately the nerves, causing pain and dysfunction. So the question here is, what do you do when you have chronic neck pain? Number one, you must first go back to good posture. No matter what treatment that you get, or who you see, or what you take, if you don't get back to good posture, the mechanics will continue to degenerate from improper imbalances going on with the head, neck, and shoulders. So, strengthening rhomboids, stretching chest, getting inside a door. Very important to do chin tucks, posterior chin tucks from the side. If you look here, keep your chin level with the ground, tilt back, and hold it 5-6 seconds. Go forward, go back. What happens is, as the forward head posture continues, the muscles in the front of the deep anterior neck region become weaker. Those muscles we need to strengthen, keeping the chin forward, tucking it straight back without bending forward or backwards. You can do several sets of going back, 5 seconds, and go forward, back, forward. You can do sets of 12, couple sets every other day. Now, natural anti-inflammatories, an excellent thing you should be using: turmeric, quercetin, ginger, bromelain. If you are taking non-steroidal anti-inflammatories, you need to be careful because there are many side effects. Although, when it comes to nutrition, lots of greens, lots of water, hydration. Remember, the discs is mainly composed of water, and as we get older, these discs become more avascular. They work through diffusion. We need to drink lots of water. It will help the discs. It will help to rehydrate those discs. The discs are important because it separates the vertebrae, keeps the vertebrae apart, allowing the nerve that comes out to stay open nice and wide. Over-the-door mechanical traction. I put the link below so you can see my video on that. For people who have chronic neck problems, you can use over-the-door traction. It distracts the head upwards, and that video will show you a lot of good information about that. Using ice is a great therapy. People say, well, the problem's not acute. Can I use ice? Absolutely. Ice can be used at any time. About 10-15 minutes, put a paper towel between the ice pack and the skin so you don't burn the skin, because the skin will act as an analgesic, and you don't want to get frostbite. Moist heat, very good, better than regular heat. Moist heat penetrates deeply. Do not sleep with it. Use it the most 20-25 minutes, only in chronic phases. In the acute phase, never use moist heat. A good neuromuscular or massage therapist, an excellent person to contact to help break down trigger points, stretch the neck, increase range of motion. Take your head, your head, you can bring it over, pulling your hand to the head over to the right. You can go down and forward. You can go straight down. And you'll do the other side. Stretching is excellent. Don't ever force a stretch, just gently elongate the muscle. If you notice you can't bring your head all the way over, you only can bring it a little bit, that's okay. Little by little over time, those muscles will become more durable, more pliable, and eventually you're going to have more range of motion. Chiropractic, an excellent treatment to reduce nerve interference if you have nerve interference, if you have fixation in the joints. Ultrasound, electrical muscle stimulation. Those are the kind of therapies that physicians, chiropractors can do on you. But although the most important thing, remember, about neck problems is good mechanical posture, good mechanics. No matter what you do to a vehicle, if you don't have good alignment on the front of your tires, those tires are going to continue to wear out no matter how much you patch it up. And eventually it's going to be too late. The same thing that happens in your body. So I ask you to ask questions. Seek alternatives, natural ways, obviously, that are not going to be invasive. It's not going to injure you or cause permanent problems. Leave your questions below. I ask you to share this video and get excited because the pain will go away if you start following the right rules. Make it a great day. I'm Dr. Alan Mandell.